Welcome to our comprehensive guide on suture classification. Sutures are essential in surgical procedures, providing the means to close wounds and support healing. Understanding their classification helps medical professionals choose the right material for each situation. In this video, we'll explore the basic categories, structural differences, and the unique properties that make each suture type suitable for specific clinical needs. Let's start by looking at the primary ways sutures are classified, setting the stage for a deeper dive into their characteristics and uses. Suture materials are first classified based on their source or manufacturing process. There are three main categories: natural, synthetic, and metallic. Natural sutures are derived from biological sources such as silk or catgut. Synthetic sutures are made from man-made polymers, offering consistent performance and predictable absorption rates. Metallic sutures like stainless steel, tantalum, gold, and silver are used in specialized situations requiring high strength and durability. This classification provides a foundation for understanding the diverse options available to surgeons. Absorbable sutures are designed to be digested by the body's enzymes or hydrolyzed by tissue fluids. These sutures gradually degrade, losing their tensile strength within 60 days. They are ideal for internal tissues that heal quickly, eliminating the need for removal. The body naturally absorbs these materials, making them suitable for procedures where long-term support is unnecessary. Understanding absorbable sutures is crucial for selecting the right thread for healing tissues, minimizing patient discomfort and intervention. Non-absorbable sutures are not digested by tissue enzymes and remain encapsulated or walled off in the body. These sutures maintain their tensile strength for more than 60 days, making them suitable for situations requiring prolonged support, such as skin closure or cardiovascular repairs. Non-absorbable sutures can be made from natural, synthetic, or metallic materials, each offering unique advantages. Their durability ensures that the wound remains securely closed until healing is complete. Monofilament sutures are made from a single strand of material. Their smooth surface resists harboring microorganisms and allows for easy tying. However, they require delicate handling, as any nick or crimp can lead to breakage post-operatively. The advantages include less tissue trauma and no capillarity, making them ideal for clean surgical fields. On the downside, careful handling is essential to prevent damage, and stretching should be avoided to maintain their integrity. Multifilament sutures consist of several filaments, twisted or braided together into a single strand. This design provides excellent handling and tying characteristics, offering good strength and a soft, pliable feel. However, multifilament sutures can harbor bacteria, making them unsuitable in contaminated or infected environments. Their thicker structure may cause more tissue trauma compared to monofilament sutures, so careful consideration is needed when choosing between the two types. Both monofilament and multifilament sutures can be classified as natural or synthetic. Natural sutures, such as silk or catgut, are derived from biological sources and have unique handling properties. Synthetic sutures, made from polymers, offer predictable performance and are less likely to cause tissue reactions. The choice between natural and synthetic depends on the surgical context, patient needs, and desired healing outcomes. Some sutures, like polyester, are coated with a biologically inert, non-resorbable compound. This coating acts as a lubricant, dramatically reducing surface friction and allowing the thread to pass more easily through tissues. However, the coating can make knot security an issue, as the material may untie if not secured with a surgeon's knot. Understanding the role of coated sutures helps in selecting the right material for procedures requiring smooth passage and reliable knotting. Non-coated sutures lack the lubricating layer found in coated types. While they may have slightly higher friction when passing through tissues, they generally offer better knot security. Non-coated sutures are preferred in situations where reliable knotting is crucial and the risk of untying must be minimized. The choice between coated and non-coated depends on the surgical requirements and the balance between ease of passage and knot reliability. Surgical threads are also classified by their diameter or thickness. The range typically goes from 1 to 0 to 10 to 0, with the higher number of zeros indicating a thinner, more delicate thread. Thicker threads are used for areas requiring greater strength, while thinner threads are ideal for delicate tissues and fine suturing. Understanding thread diameter helps surgeons select the appropriate suture for each specific tissue type and surgical need. Metallic sutures are made from materials such as stainless steel, tantalum, gold, and silver. These sutures are used in specialized situations where high strength and durability are required, such as orthopedic or cardiovascular surgeries. Metallic sutures are non-absorbable and provide excellent support, but their rigidity can sometimes cause discomfort or tissue irritation. Their unique properties make them indispensable in certain surgical fields. The distinction between absorbable and non-absorbable sutures is fundamental in surgical practice. Absorbable sutures are broken down by the body, making them ideal for internal tissues that heal quickly. Non-absorbable sutures remain in place, providing long-term support for wounds that require extended healing. The choice depends on the location, healing time, and patient needs, ensuring optimal outcomes for each procedure. Monofilament sutures offer several advantages, including a smooth surface that minimizes tissue trauma and prevents bacterial harboring. Their single-strand design ensures easy passage through tissues and reduces the risk of infection. However, their delicate nature requires careful handling to avoid damage. These sutures are particularly useful in clean surgical fields where minimizing tissue reaction is a priority. Despite their benefits, monofilament sutures have some disadvantages. They must be handled delicately, as stretching or nicking can lead to breakage. Their lack of flexibility can make tying knots more challenging, and any damage to the strand compromises its strength. Surgeons must weigh these factors when choosing monofilament sutures, especially in procedures requiring secure closure and minimal tissue trauma. Multifilament sutures are known for their excellent handling and tying characteristics. Their braided or twisted design provides good strength and a soft, pliable feel, making them easy to work with during surgery. These sutures are ideal for procedures requiring secure knots and flexibility. Their structure allows for reliable closure, especially in areas where tissue movement is expected. While multifilament sutures offer many benefits, they also have drawbacks. Their braided structure can harbor bacteria, making them unsuitable for contaminated or infected wounds. The thicker design may cause more tissue trauma compared to monofilament sutures. Surgeons must consider these factors when selecting multifilament sutures, especially in environments where infection risk is high. Natural sutures include materials like silk and catgut. Silk is prized for its smooth handling and knot security, while catgut is absorbable and used for internal tissues. These materials have been used for centuries, offering reliable performance in various surgical contexts. Their biological origin can sometimes cause tissue reactions, so careful selection is important based on patient needs. Synthetic sutures are made from polymers such as nylon, polyester, and polypropylene. These materials offer predictable performance, consistent absorption rates, and minimal tissue reaction. Synthetic sutures are available in both absorbable and non-absorbable forms, providing versatility for a wide range of surgical procedures. Their reliability makes them a popular choice in modern surgery. Metallic sutures include stainless steel, tantalum, gold, and silver. Stainless steel is commonly used for its strength and resistance to corrosion. Tantalum, gold, and silver are used in specialized cases where unique properties are required. These sutures are non-absorbable and provide long-term support, making them essential in certain surgical fields. Handling monofilament sutures requires care to avoid stretching or damaging the strand. Surgeons should use gentle techniques and avoid excessive force when tying knots. Any nick or crimp can compromise the suture's strength, so precision is key. Proper handling ensures the suture maintains its integrity and provides reliable wound closure. Multifilament sutures are easier to handle and tie, thanks to their braided structure. Surgeons can achieve secure knots with less effort, and the soft, pliable material adapts well to tissue movement. However, care should be taken to avoid contamination, as these sutures can harbor bacteria. Proper technique ensures reliable closure and minimizes infection risk. Coated sutures offer reduced surface friction, allowing for smoother passage through tissues. The biologically inert coating minimizes tissue reaction and enhances patient comfort. These sutures are ideal for procedures where ease of passage and minimal trauma are important. However, knot security must be carefully managed to prevent untying. While coated sutures provide many benefits, they can make knot security an issue. The lubricating layer may cause knots to untie if not secured properly, requiring the use of specialized knots like the surgeon's knot. Surgeons must balance the advantages of reduced friction with the need for reliable closure, ensuring patient safety and optimal healing. Selecting the right thread diameter is crucial for surgical success. Thicker threads provide greater strength and are used for areas under tension, such as fascia or tendons. Thinner threads are ideal for delicate tissues, like skin or blood vessels, where minimal trauma is essential. Surgeons must assess the tissue type and healing requirements to choose the appropriate diameter. Absorbable sutures are commonly used for internal tissues that heal quickly, such as muscle, fat, or gastrointestinal tract. Their ability to degrade eliminates the need for removal, reducing patient discomfort and risk of complications. These sutures are ideal for procedures where temporary support is sufficient, allowing the body to complete the healing process naturally. Nonabsorbable sutures are used for skin closure, cardiovascular repairs, and other situations requiring prolonged support. Their durability ensures that the wound remains securely closed until healing is complete. These sutures may need to be removed after healing or left in place permanently, depending on the clinical context. Their versatility makes them indispensable in many surgical procedures. Monofilament sutures are preferred in clean surgical fields where minimizing tissue trauma and infection risk is important. Their smooth surface allows for easy passage through tissues and reduces the likelihood of bacterial harboring. These sutures are ideal for procedures requiring secure closure and minimal tissue reaction. Multifilament sutures are used in procedures requiring secure knots and flexibility. Their braided structure provides good handling and adapts well to tissue movement. However, they should be avoided in contaminated or infected wounds due to their potential to harbor bacteria. Proper selection ensures optimal healing and patient safety. Natural sutures like silk and catgut are used in various surgical procedures. Silk is favored for its handling and knot security, while catgut is absorbable and suitable for internal tissues. Their biological origin provides unique properties, but tissue reaction must be considered when selecting these materials. Synthetic sutures are widely used in modern surgery due to their predictable performance and minimal tissue reaction. They are available in both absorbable and non-absorbable forms, providing versatility for a range of procedures. Surgeons rely on synthetic sutures for reliable closure and optimal healing outcomes. Metallic sutures are used in orthopedic, cardiovascular, and other specialized surgeries requiring high strength and durability. Their non-absorbable nature ensures long-term support, making them essential for procedures where permanent closure is needed. Surgeons must consider the rigidity and potential for tissue irritation when selecting metallic sutures. Absorbable sutures are not suitable for tissues requiring prolonged support, as they lose their strength within 60 days. Their degradation can sometimes lead to premature loss of wound closure, especially in areas under tension. Surgeons must assess healing time and tissue requirements to avoid complications. Non-absorbable sutures may require removal after healing, which can cause discomfort and risk of infection. Their permanent nature can sometimes lead to tissue irritation or encapsulation. Surgeons must balance the need for long-term support with patient comfort and safety. Monofilament sutures can be challenging to tie securely, and their lack of flexibility may complicate certain procedures. Any damage to the strand compromises its strength, increasing the risk of wound dehiscence. Surgeons must use precise techniques to ensure reliable closure and minimize complications. Multifilament sutures are not suitable for contaminated or infected wounds due to their potential to harbor bacteria. Their thicker structure can cause more tissue trauma, increasing the risk of complications. Surgeons must carefully select sutures based on wound environment and healing requirements. Natural sutures can cause tissue reactions due to their biological origin. Silk and catgut may induce inflammation or allergic responses in some patients. Surgeons must consider patient history and potential for adverse reactions when choosing natural sutures. Synthetic sutures, while reliable, can sometimes cause minimal tissue reaction or foreign body response. Their predictable performance is generally advantageous, but rare complications may occur. Surgeons must monitor healing and adjust suture selection as needed for optimal outcomes. Metallic sutures can cause discomfort or tissue irritation due to their rigidity. Their permanent nature may lead to encapsulation or migration in some cases. Surgeons must weigh the benefits of strength and durability against potential complications when selecting metallic sutures. Coated sutures may compromise knot security, requiring specialized techniques to ensure reliable closure. The lubricating layer can sometimes interfere with tissue integration, affecting healing. Surgeons must use proper knots and monitor wound healing to minimize complications. Non-coated sutures may have higher friction, causing more tissue trauma during passage. Their lack of lubrication can make handling and tying knots more challenging. Surgeons must balance the need for knot security with patient comfort and tissue preservation. Choosing the wrong thread diameter can compromise wound closure. Thicker threads may cause excessive tissue trauma, while thinner threads may lack sufficient strength. Surgeons must carefully assess tissue requirements and healing needs to select the optimal diameter for each procedure. Selecting the right suture involves considering material, structure, coating, diameter, and clinical context. Surgeons must assess tissue type, healing time, infection risk, and patient needs to ensure optimal outcomes. Proper suture selection minimizes complications and supports effective wound healing. Sutures are classified by source, absorbability, structure, coating, and diameter. Each category offers unique properties and advantages, allowing surgeons to tailor their approach to each patient and procedure. Understanding these classifications is essential for effective wound closure and optimal healing. Applying suture classification knowledge in clinical practice ensures the right material is chosen for each wound. Surgeons must balance healing requirements, infection risk, and patient comfort to achieve the best outcomes. Proper suture selection supports effective wound closure and minimizes complications. In summary, understanding suture classification is vital for surgical success. By considering material, structure, coating, diameter, and clinical context, surgeons can select the best suture for each procedure. This knowledge supports optimal healing, minimizes complications, and enhances patient outcomes. Thank you for joining us on this journey through suture classification.